So amazing people, welcome back once again. Today I bring you amazing breastfeeding tips that are going to help you to become an expert in the area of breastfeeding. So number one, when you come back from the hospital, immediately after having your baby, make sure that you put your baby to the breast. Make sure that you start giving your baby breast milk. Even if your breast milk doesn't come in immediately, some people, their breast milk delays and comes in the next day. Like, that is the experience I always have. And there are moms that are lucky that immediately they give birth, their breast milk is already flowing. So one thing that is going to help your breast to come in is when you put your baby to the breast to start sucking. So once you give birth to your baby, make sure that you put your baby to the breast to start sucking. And in doing so, the breast milk is going to flow very well. And that is what every mom wants, for the breast milk to flow very well so that the baby can enjoy their food. Because at that point, the only food they are supposed to take is breast milk. So putting them to the breast immediately after birth stimulates the breast glands, stimulates your brain to send signal to the breast to start producing milk. Do not be scared, even if it doesn't come that day. When you start practicing putting your baby to the breast milk is going to come the next day, and your baby is going to have a very pleasurable moment with you, and you as the mom are also going to be very, very happy. Number two, if you are outdoors and you're the shy type, please seek privacy. Wherever you find yourself is appropriate for you to seek privacy. When you seek privacy to breastfeed your baby, your mind is at ease. And when your mind is at ease, your baby's mind is also at ease. So when you're out there, maybe at the hospital, maybe wherever you are, in the bus, in a car, in a taxi, going out somewhere, or in an environment where you are not familiar with, you can just find a place where you can excuse yourself and find a very private place where you and your baby can have a very good breastfeeding experience. When you're at ease while breastfeeding your baby is also at ease. So feel free to seek privacy wherever you are, in the hospital, in a bus, in a car, in a taxi. You can take a piece of cloth or a napkin and cover your breast area if you're not comfortable breastfeeding outside, and you'll be good to go. Also, when going out, make sure that you hold something like a handkerchief or a face towel so that when your baby cries or you feel like your baby is hungry to eat, you can just use it and cover your breast if you're the shy type, so that nobody is going to be looking at you anyhow. And remember that breastfeeding is not a shameful thing to do. It's a must, and you have to breastfeed your baby, but do it in a way that you can be very, very comfortable. So find yourself privacy so that you can be at peace, so that your mind can be at ease, and your baby's mind can also be at ease. Remember that when your baby's mind is at ease, they eat well. So please, when you're out there and you're shy and you feel like I can't bring out my breast to feed my baby, please ask for a private place. Stay there, cover your breast, feed your baby, because it's a must. You must feed your baby, whether you like it or not. If you're a breastfeeding mom or you have breastfed a baby before, sometimes when you're breastfeeding your child, you realize that they are fuzzy. They are fuzzy, they begin to cry. They don't even want to put their mouth on the breast. Sometimes what causes it is that the diaper is full. The diaper is wet. Maybe they have poop in the diaper, or they have wee-wee, or they have peed in the diaper. And the diaper is so full that they are not comfortable enough to feed, to eat peacefully. So one tip for you and your baby to have a pleasurable breastfeeding experience is for you to always change diaper before breastfeeding your baby. Yes, change their diaper. Check if the diaper is full before doing what? Before breastfeeding your baby. And when you do that, you realize that the baby is calm, the baby breastfeeds longer, the baby eats very well. Change their diaper, let them be clean before you breastfeed them, and that will help them to breastfeed and feed very, very well, with all pleasure. Another tip to a successful breastfeeding is to make sure that you get the whole nipple with the areola into the mouth of your baby. Make sure that the areola or the areola gets into the mouth of your baby with the whole nipple. The areola or the areola is the dark part of your nipple, the dark circle around your breast, surrounding your nipple. So make sure that you put all that place into the mouth of your baby to suck. When you do this, your baby's tongue on the areola causes breast milk to flow very fast. It stimulates breast milk to flow really fast. So make sure you get the areola or the areola into the mouth of your baby with the nipple. Don't put the nipple alone, because when you do that, you're going to get sore. You're going to have a bad breastfeeding experience. The baby is going to pull so hard, and you're going to have a cut on your nipple that is going to make your breastfeeding experience very bad, very disastrous. So make sure that when you're putting the nipple, it doesn't only you don't only put the nipple into the mouth of your baby. Make sure that the areola, the dark part of your nipple, also goes into the mouth of the baby. It makes the baby feed very well. It makes the breast milk flow very freely and very fast, and the baby enjoys the breastfeeding moment when you do this. But when you do it the other way around, putting only your nipple into the mouth of your baby, you're really going to cause havoc to your nipple. You're going to cut yourself, you're going to bleed, and you're going to be bruised around your nipple area. So please breastfeed your baby the right way. Okay? So amazing people. Lastly, cleanliness is very, very key. Cleanliness is very, very crucial while breastfeeding your baby. So before and after you breastfeed your baby, make sure you get a wet, damp cloth. You can make it warm and use it to wipe your nipple area. Use it to wipe the areola and the nipple very well before you feed your baby, so that you do not transfer germs or bacteria to them. Sometimes our cream and our lotion is very strong scented. Our perfume is very strong scented. After breastfeeding your baby, milk residue can be left around the nipple area. So it's very, very important to clean that area. Wipe it down with a damp, warm, wet napkin before you breastfeed your baby to avoid infection. So as a mom, it's your duty to make sure you wipe down the boobie area. Make sure you wipe down the boob area before you start breastfeeding your baby to avoid passing on any infection onto the baby or any allergy onto the baby. So these are the things you're supposed to do while breastfeeding your baby. These are the do's of breastfeeding. When you do all these things, your breastfeeding experience is going to be very, very pleasurable. You're even going to become an expert while doing this. Thank you for staying with me till this time once again. And if you watched till this time, please consider subscribing to my channel, because we have amazing content here on Miriam's Daily Wisdom Nuggets. See you again. Bye.